Hello, class. My name is Leonidas Lopez, and today I'll be discussing the importance of a cold stroke and why is it very important to bring the patient straight to CT when they call a cold stroke. So, a little bit about myself is I'm currently working as a CT tech at Hollywood Presbyterian and White Memorial Medical Center. I've been working as a CT tech for 2 years now, and I've experienced a wide variety of cold strokes, and talk about a little bit of how what's the process of it. So I'm arguing that it's very important to bring the patient straight to CT when they call a cold stroke. Normally, how it plays out, they call a cold stroke, and you have labs running in trying to get labs. We have doctors going in and trying to assess the patient, and then there's nurses coming in and registering the patient, getting all the information. So I'm arguing that it's all of those are important, of course, but I'm arguing that CT is the most important because when we do a CT scan, we're actually going to be able to see the degree and how acute and how the damage of a cold, if it's an actual cold stroke or if it's just the signs and symptoms and there's nothing to worry about. So when cold stroke is called, everybody's rushing in there, and we need to bring the patient straight to CT. That's the main focus because also getting timed. Everybody's getting timed, but for us, it's the scan itself is less than 3 minutes long. The what takes the longest is having all the information that we just got, reformatting, and then sending it to the radiologist. And then once the radiologist get it set, it's they're gonna be getting about 200 to 300 images, and just the processing of post processing, getting that data into PACS system, and then reviewing the information. It takes time. So I believe the most effective way to do this is get the patient straight to CT. Do the CT scan first, then do the labs. Then have the doctor could even they could even be in the CT room assessing the patient. The nurses could be in the CT room starting the IVs, and it'll be a much efficient, much faster um, way to get all the information that they need to, especially to diagnose this patient. So what we need in a once they call it cold stroke, once they have the patient in the table, once there's our patients on the table, and we do the scan that takes 3 minutes long, then they could run everything else. They could do the labs and whatnot, like what I just mentioned. At that point, they're probably gonna order CT angio exam of the head and neck, looking at the carotids. And by the way, this is a CT. This is an actual stroke right there. The white, it's blood that's accumulating. And at that moment, they also my other topic is making sure we do get the appropriate IV. We need to get a 20 gauge IV on the left or right AC, because if they start, I understand that some patients are very hard sticks, but if we don't get the appropriate IV size, the appropriate in the correct location, our diagnosis may we may not get the appropriate diagnosis for this patient, and getting the appropriate diagnosis is critical, especially for a cold strokes event. So I need at least a 20 gauge in the left right AC so that we could do an angio exam. So for an angio exam, we're injecting contrast to the body. We're injecting contrast through the IV, through the vein, and it's gonna go all over. First, it's gonna go to the heart, and then from the heart, it's gonna go everywhere into all around the body. We need to. We're gonna be pushing contrast at a roughly like 4.0 milliliters per second. That's a very fast rate. So if I have a 22 gauge line on the left or right AC or in the hand, chances of infiltration are high, and that's just gonna create more damage to the patient. It's gonna we're gonna have to re-stick them again. We have to put a pack because there's gonna be a buildup of contrast. So we need to make sure, especially for any patients, we need to make sure we have the appropriate gauges, because if we don't, the exam's not gonna be as accurate. The radiologists are not gonna be able to read it, and it's gonna be a faulty exam. So bring the patient in. First thing, do CT. Put them on the table, and then do the exam. 3 minutes long. The patient could stay in the CT table while everything else is happening. At that point, put the line, put the IV on, get the information. The doctor could be there assessing the patient, and then from there move on to the next step. Most likely, angio exam. The patient's already in the table by that time. All the images are already out. Then we proceed to doing the next exam, which is the angio CTA head and neck. After that, we're done. We'll be done less than 10 minutes. Patient's out of the room. All the images are still getting processed. Doing an angio exam, depending on the type of scanner we have, I currently work with a 64. It's a very fast scanner, but the reconstruction takes forever. So at that time, just wait it out like maybe like 15 minutes for everything to get like fully being sent. Like it get reprocessed and then it gets sent to PACS, and then doctor can start reading the images, and then hopefully by then like 10 minutes more, we'll have a report over. The radiologist will call the doctor, the ER doctor, and let him know if it's an actual stroke. What are his what else his recommendations are. Maybe go to MRI. Maybe do a additional examining. But yeah, so that's what I'm trying to fight for. I'm trying to get the I'm trying to get the patient as soon as possible to the CT room so we could do the exam and get the exam done over with before anything else. Thank you, class. Have a good day.